Skilled nursing facilities, an employment option for registered nurses pursuing a Bachelor of Science in Nursing degree. In today's society, the younger generations are finding it more acceptable than ever to place their parents or grandparents in skilled nursing facilities, or SNFs for short. This is providing an employment opportunity for new nurses in a specialty of nursing. Unfortunately, the specialty of gerontology is not usually the first choice for a career path for new nurses graduating with their associate's degree in nursing. Our age expectancy is rising due to improved medical care and from being more informed about health, nutrition, and general well-being as a society. This ever-growing population of older adults opens an opportunity for registered nurses. Stereotypically, there is a negative perception of working at a skilled nursing facility compared to a hospital or an acute care establishment. When a nurse says, "I'm just working in a nursing home," like it's not a real job, that discredits the work they are doing and the care they are providing, which is now of a more holistic nature than ever, because the patients are usually residents for a long period of time. So, our group has gathered arguments to both support and oppose working in a skilled nursing facility as a registered nurse when compared to working in a hospital setting. Brought to you by Michele Lozier, Loretta Parsons, Vika Gruntkovskaya, and Tawwater. We'll begin with the conceptual thread for the RN to BSN program. The benefits for the students. The working RN can benefit from their associate's degree and from being employable, which helps to support furthering their education in a BSN program. By working, applying one's studies, and learning the latest evidence-based practices and research, nurses can learn to balance their own personal lives, jobs, and school. According to an article by Fussell, McInerney, and Patterson, the shortage of qualified aged care nurses has occurred at a time when the demand for aged care services is increasing. The RN to BSN program can offer awareness of and a career opportunity in the gerontology field, with a positive approach through clinical placements. The university and their students can benefit by having hands-on clinical placements and by increasing awareness of the specialty of gerontology with more potential for a career path in skilled nursing facilities, which is an increasingly important but underserved area of our medical community. RN to BSN nurses are really being exposed to and groomed for specialty paths that a BSN graduate can take, but it depends on the registered nurse's attitude and perception of specific facilities. Each establishment has its own positives and negatives, so it really comes down to the nurse's decision as to what atmosphere is going to be the best fit. Terminal objectives for the BSN program. BSN program outcomes. Number 1. Competence in provision of care. A. Formulating nursing practice decisions using evolving knowledge and research. To complete this project, we used research that shows the effects of skilled nursing facility job requirements on patient care and nurse burnout and job satisfaction, which can be used when making the choice of where to practice as a nurse. B. Use developmentally appropriate teaching learning principles to assist colleagues to improve the quality of their nursing care. A PowerPoint presentation citing research articles is an appropriate teaching style for students in the BSN program. Number 2. Professional values. A. Demonstrate the values central to nursing practice, including altruism, autonomy, human dignity, integrity, and social justice. We discuss how skilled nursing facilities nursing practice involves these attributes: demonstrating selfless concern for the well-being of others, making independent decisions, providing care to vulnerable patients so that their dignity is maintained, having strong principles to work in a tough environment, and providing the best care possible for a vulnerable population. B. Protect the rights of people to receive optimum care and make informed decisions affecting their welfare. we discuss the importance of changing and improving environments that we come across that do not provide optimum care and education. Number 3, role development. A. Uphold the standards and values of the profession, including accepting responsibility for learning and personal growth. This presentation covers the values listed above, plus we cover how we can make the effort to learn and immerse our practice in vulnerable populations found in skilled nursing facilities. B. Interpret professional nursing using perspectives gained from past, present, and future trends in nursing and society. We explore the trends of the aging population and trends in nurse-to-patient ratios and what those mean to the nursing profession. C. Advocate for responsible, humane healthcare policies. We discuss how nurses can change the environments and policies in skilled nursing facilities with which they do not agree. D. Participate in revision of healthcare policy and practice within a rapidly changing global environment. We suggest the Registered Nurse Safe Staffing Act of 2013 as one way to participate in changing policy and practice. So let's begin. What is a skilled nursing facility? We abbreviate skilled nursing facility with SNF, which we pronounce SNF. By its simplest definition, SNFs provide skilled care to patients and clients. Skilled care includes services provided by trained professionals during injury or illness. Usually, skilled nursing facilities are used as bridges between hospital stays and returning home. Patients are stable enough to leave the hospital, but require treatment and medical supervision not readily available at home. Skilled nursing facilities also include the more long-term placement facilities that provide custodial care, like activities of daily living, as long as they also provide skilled nursing care. Fort Vancouver Convalescent Center here in Vancouver is a good example of a skilled nursing facility. Its patients include those in need of short-term rehabilitation after procedures, long-term care, and short-term respite stays. Skilled nursing facilities typically have a census predominated by elderly patients. You can see on this graph, according to Reinhardt and Young, in 2005, the number of adults 65 years old and older was 12.9%. By 2030, the percentage is predicted to increase to 20% of the total population of the United States. This means there will be an increased need for gerontologically focused nursing care in the coming years. When we began researching the pros and cons of working in a skilled nursing facility, we found this flowchart. Every pro and con we discussed during this presentation is directly or indirectly related to this illustration, as they are all factors that influence nurses' employment decisions at any facility. We'll begin on the right side, intent to leave. We're starting here because with every job, there is an intent to leave at some point. We may want to stay for a long time, or we may want to leave as soon as possible. The intent to leave is affected by your job satisfaction, and it's affected by your commitment to the organization. Job satisfaction and commitment to the organization are both affected by perceived organizational support and by the ethical climate of the organization, which includes an atmosphere that's caring, that has law and code, that has rules, and offers independence for the employees to a reasonable degree. So, depending on how good or poor the organization does with their ethical climates, it can affect your job satisfaction for better or worse, which affects your intent to leave for better or worse. And same thing with the perceived organizational support. If you're getting support from the organization, you're going to feel more committed to them, and you're going to be happier about your job. And that works the other way too. So basically, all of these things kind of tie in together, to affect whether you want to stay with your job or not. And that's kind of what we're looking at when we come to looking at factors of job satisfaction for working as a nurse in a skilled nursing facility. Pros for working in a skilled nursing facility. The pros for working in a skilled nursing facility can be interpreted different ways, depending on a person's perspective or outlook on nursing career opportunities. For example, nursing homes can offer more of a medical community rather than the broadly interdisciplinary atmosphere in a hospital. Skilled nursing facilities are usually privately owned by an individual or by an organization where employees' opinions are considered and valued to improve the establishment's short-term and long-term goals. In this way, nursing homes are considered to have a caring climate, which is a climate that indicates a concern for the joint welfare of individuals or the organization as a whole. This climate also encourages a holistic approach to the physical and mental well-being of the patient. Nursing care is considered a biomedical model, which is looking after the person rather than the disease. By implementing this model, patient interactions with the medical staff are more productive, more personal, and create a close-knit social and medical community. Other important pros of working in a skilled nursing facility are earned as emotional rewards for caring for those most frail and vulnerable populations in our society. Working with this population also offers other rewards such as increased competence and skills, strong leadership abilities, and the feeling of positively affecting lives, including the nurse's own. For example, job satisfaction. Working in a skilled nursing facility requires giving of yourself to make others live comfortably and safe. Since skilled nursing facilities have patients stay for a longer period than in the hospital, it is more probable for a nurse to partner with the patients in order to generate better patient outcomes in terms of their health and quality of life. This can be very satisfying for the patient and the nurse. Because skilled nursing facilities often do not have the same support system of interdisciplinary professionals found in hospitals, it is an environment that can cultivate strong leadership skills, as nurses learn to operate fully within their scope of practice and to delegate appropriately. Patients often have high acuity, chronic conditions, and/or a complex array of comorbidities that require a high level of clinical skill and cultural competence. This requires nurses to be skilled in general wound care, stroke recovery, assisting with activities of daily living, hospice care, general rehabilitation after an extended illness or invasive procedure, and nursing care of multiple comorbid acute and chronic medical conditions. Number 7. Opportunity to make changes. Another pro of working in a skilled nursing facility is the opportunity to make a change, whether it's on a local level or all the way up through an international level. The nurse leader featured in the article Under the Influence encourages nurses who see something disconcerting or inappropriate in a nursing home to stay there long enough to change and improve these things. Embedded in this particular article, the nurse also says that working with older adults is inherent in nursing regardless of what type of facility you're in. She tries to teach her nursing students that working in a skilled nursing facility could be the best possible career choice for new nurse graduates. The link here, if you click on this picture, it actually links you to the video. It's about a 4 or 5 minute video, and we were hoping we'd have time to play it during the presentation, but we don't. So it's a very inspiring video though, so we would encourage you to go back and click on the link and watch the video sometime in your free time. You're looking for something fun and inspiring to do. Cons of working in a skilled nursing facility. As you'll see, Some of the concepts that can be considered pros for working at a skilled nursing facility can also be considered from another perspective to be cons. And some of the cons seem to be in direct contradiction to the asserted pros. For example, let's look at number 1. Non-acute nursing skills. Skilled nursing facilities have been associated with a lack of progress, set daily schedules, ageism, lack of status on several different levels, and non-acute nursing practice. In the article, Experiences of Graduate Registered Nurses in Aged Care, a Case Study, participants expressed that the acute care setting would provide them with greater opportunities to develop the clinical skills, and that aged care was not seen as an area that could provide opportunities to practice and enhance their acute care skills. Another factor that possesses a negative implication is the lack of medical technology in long-term care facilities. However, some participants in the study expressed their assessment skills were actually sharpened without the aid of medical technology on which to rely. Number 3. Having a higher patient-to-nurse ratio in a skilled nursing facility is a con and can lead to increased stress for the nurse, decreased patient satisfaction, decreased patient outcomes, and an increased risk of impaired safety. In the hospital setting, the nurse has fewer patients than the nurse working in a skilled nursing facility. It is not uncommon for a nurse at the skilled nursing facility to have more than double the patient load of a nurse in a hospital setting. As a real-life example, the patient-to-nurse ratio at the skilled nursing facility one of our group members works at is up to 13 patients per single nurse for a day shift position, and up to 22 patients per single nurse for a night shift position. However, according to this team member, the medical surgical floor at the Peace Health Medical Center in Longview, Washington, an acute care facility, has a maximum of 6 patients to 1 nurse. As you can see on this graph, hospital nurses reported caring for, on average, 5 patients. Here we have hospital, home health, nursing home, and other. The red means it's the mean patient-to-nurse ratio, so that's what we'll be looking at here, are the red bars. In the hospital, it's they're reporting about 5 patients per nurse. In the nursing home, they're looking at almost about 13 patients on average per nurse. That's a big difference. Another interesting thing to note on this chart is that even though burnout is the orange, burnout is highest in acute care facilities such as the hospital, especially when you compare to the others. See? Even though burnout is highest in acute care facilities, the intent to leave, which is the blue, is highest at the nursing homes. This next graph illustrates an analysis of national level data exploring turnover rates and retention rates among nursing homes on a national level. For registered nurses, which is the red bars here and here, in a given year, 56% of the nurses will leave their position. This is the turnover rate. However, of all RNs hired into nursing home positions at variable times, 67.3% of them will ultimately choose to stay put. Okay, moving on. In addition to the high patient ratios, another factor affecting the nurse's workload is number 4, inadequate staffing. According to an article by Zhu and others, the inadequate staffing of nurses in skilled nursing facilities could result in missed nursing care and decreased positive patient outcomes. However, another important aspect of staffing deficiencies is related to the high percentage of direct care providers who intend to leave, and that most of those nurses are employed in nursing homes. So unfortunately, a high staff turnover is just always expected in these facilities. Number 5, decreased nurse confidence. In another study, it was shown that nurses who had less patients reported that their confidence in the quality of care for the patient increased, and patients reported higher levels of satisfaction. Additionally, nurses perceived that the patient's ability to properly care for themselves on discharge was positively impacted when the nurse had fewer patients. Number 6, less successful rehabilitation. In the article, Rehabilitation in Skilled Nursing Facilities, Effect of Nursing Staff Level and Therapy Intensity on Outcomes, the authors state that higher nursing staff levels and therapy intensity are related to overall better patient outcomes and safe discharge back into the community. Get involved. A couple of ways to get involved. We can get involved on a state level, we can get involved on a national level. Currently, on a state level, there's 15 states that have regulations and/or legislation that govern nurse staffing. Here locally in the state of Washington, we have the Safe Nurse Staffing legislation, which requires hospitals to have a nurse staffing committee. Half of the members on the committee must be nurses who actually provide direct patient care. On the national level, in current national news, there is a bill called the Registered Nurse Safe Staffing Act of 2013 that was referred to a subcommittee in Congress, which will require all Medicare participating hospitals to have a committee which will look at the acuity and the number of patients in units individually and make sure nurse staffing ratios are planned accordingly. There will be requirements and penalties applied to these decisions made. Although this is currently only for certain Medicare providers, it is a standard that can be advocated for and supported by nursing unions and other groups, and with some work, eventually it can be extended to all Medicare providers, including skilled nursing facilities. Conclusion. Just like with any job, working in a skilled nursing facility has its advantages and disadvantages. Knowing the pros and cons prior to agreeing to work at a skilled nursing facility can be an important part of determining whether it's the right place for the new nurse. This knowledge can help determine if it is an appropriate match for the nurse to meet his or her personal and career goals and to be able to provide the best nursing practice. Thank you very much.